Revascularization or pharmacotherapy in coronary artery disease, what is your opinion?
Well, it depends what form of revascularization. I think that the first decision that one has to make is the patient suitable for medical therapy? And that depends upon the symptoms, it depends upon the anatomy of the coronary arteries, the severity of the obstruction, how much the left ventricle works. And for those people who have more severe disease, in general, revascularization is preferred. Then also, if medical therapy doesn't work or they don't tolerate the drugs. The next big question, though, is, now, if you're going to revascularize the patient, is it bypass surgery or stenting? And that, again, depends on the kind of blockage, how extensive it is, where it is it suitable technically for a stent? Because, bypass surgery is a big operation, and stenting is less. So it's a complex decision that is made. We do have trials, but the trials are quite old, some of them, several years old, and since we've done the trials, there have been a number of new stents and new advances. I think what it really boils down to is the more complex the disease, the more it favors surgery, but then you have to bring something else into the equation, and that is the patient. What about the patient's kidneys? Have they had a stroke? What about their age? Are they mobile? Are they active? And so it is a technical decision, but ultimately you have to take the technical issues and bring the patient into the picture. So just because a trial shows that after 10 years one survival curve is a little better than the other, that may not apply to someone who's 19. So I think what we've learned is we've got very good at both techniques. I mean, we do good surgery and we do very good stenting, but there are other issues that are just as important.
What is the role of microcirculation in coronary artery disease, and is a choice between revascularization and pharmacotherapy?
No, the role of it, and it's a very good question. The microcirculation, I think what we are starting to understand, and people like Dr. Kreyer, who is here at this meeting, we're starting to understand that the microvascular circulation plays a very important role in coronary disease. At this stage, it does not. At this stage, if a patient has a blocked artery, the microvascular circulation does not play a role in whether we do stenting or whether we do surgery. In patients with non-obstructed arteries, you know what I mean by that, where there's no blockage, that may be, these are people, mainly women, they come with chest pain, the artery is open, but they have real angina. That is a microcirculatory disease. We do not yet know how to treat it. The first trial is only just starting now. So I think the microcirculation is something that we will learn a lot more about over the next 5 years. It's important. It's very important, and I think people are starting to realize that, but we don't really know what to do about it yet. All right?